they say that their dentist is telling them that they are weakening their children's teeth by going plant-based. And so they're asking you how to prevent this.
Well, I'm really surprised to hear that. There is nothing in the eating of the flesh of animals that's going to strengthen your teeth per se. And not eating the flesh of animals should not weaken your teeth. We're not obligate carnivores in that way. And so I'm dubious of that. Now, if the dentist is noticing that the teeth are not healthy, there's a couple of things to consider. One, whether the plant-based diet is really complete for these folks, what the child is eating. If they're living on granola bars and sugary cereals, and this passes for a vegan diet, yeah, that's not going to be healthy. They just don't have the minerals, they don't have the calcium, they don't have the balance in their diet that they need. And that goes beyond their dental health. That's going to be affecting their whole body. You know, we need absolutely a whole food, plant-based diet with green and yellow vegetables and some legumes and grains, etc. And it's up to the parents to find ways to help their child consume a balanced diet. You need to make it taste good. You need to work with the child, bring them into the kitchen, season it up, take advantage of the flavors they do like. There's a whole world of getting children to eat healthy, and I invite people to do some searches on feeding vegan children. If you search on that term, there's some wonderful articles from Vegetarian Resource Group and others on how to prevail upon your child to get a healthy food stream going. You can blend soups and salads and season them. There's ways to do that. So one is, the food stream needs to be health supporting on every level, and it's up to the parents to make sure that happens. But the other issue, of course, is the local conditions in the mouth. If the child is eating dried fruits and not cleaning their teeth afterwards, and they've got a lot of fructose and fibrous debris down tucked in along their gum lines there, well, that's the Hilton Hotel for bacteria. They love that, and they're going to put out acids and erode away the teeth, etc. And for that reason, important to instill good dental hygiene habits in the child. And the next time you're bringing the child to the dentist, have the dental hygienist talk to them about here's what you need to do after you eat here, and whether it's water picks or things that the kids might like to use. Really important to prevent the conditions that promote tooth decay from setting up in the teeth by the food choices and how the oral care goes after they eat the food. So you got to pay really good attention to the local effect, because children's teeth rot easily. I mean, that's the major concern. If you want to take advantage of the tooth hardening effects of fluoride, I'm a strong proponent of, if that's desired, to apply the fluoride directly onto the teeth. The dentist can have them bite into a tray with a fluoride gel in it or paint on it. There's various ways to do that. But I am not a proponent of fluoridating the entire city's water supply just to reduce a couple cavities in sugar-eating kids. Fluoride needs to be applied locally. And if you want to take advantage of that, or there's these various sealants, the acrylic sealants that the dentist can apply to just physically keep the acids off surface of the teeth, fine. I'm all favor of whatever the pediatric dentist can come up with, but nothing substitutes for a good diet and good oral hygiene afterwards. And that's really the issue. But don't let a dentist who doesn't know much about whole food nutrition, whole plant food nutrition, scare you off. There's no reason that anyone eating a whole food plant-based diet should be at higher risk for dental decay. Hi everyone, Dr. Michael Klaper here, announcing our new format for our Q&A with Dr. K. Each day, Andy Hagen will be asking me one question that's been sent in by our viewers. So if you want to see if your question is getting answered, do join us for our daily Q&A with Dr. K right here. Hope to see you then.